Hello, my name is Eunice Itabiyi, and I'll be presenting my DMP scholarly project that is titled Type 2 DM Detection through ADA Screening in Patients on Antipsychotic Medication. So let's get started. I want to tell you a little about my background. I have been a psychiatric mental health nurse practitioner for 2 years now. But before being a PMHNP, I worked in behavioral health facilities for almost 23 years as a behavioral health nurse. The committee comprises of Dr. Jennifer Okna, the chair, Dr. Rita Wendalik, the second reader, and Dr. Edward Okebiorun, the community member. At a mental health clinic located in the eastern region of the United States, it was found that T2DM screening for patients on antipsychotic medications was not being done. So the student decided to focus on T2DM screening in psychiatric patients on antipsychotic medication using the ADA risk tool. So the background, type 2 DM affects millions of Americans according to CDC 2021. Diabetes is a public health concern that negatively impacts the health of many Americans. Antipsychotic medication predisposed to T2DM. Efficient screening of patients on these medications to identify at-risk patients for T2DM is critical. Among the affected individuals are adult psychiatric patients on antipsychotic medications. Undiagnosed T2DM can increase the risk of complications, frequent health services, and increased financial burdens. Most of the time, the diabetes status of the stated patient population is often overlooked despite the availability of scholarly evidence that links higher T2DM incidence with the use of antipsychotic drugs, according to Adia et al. 2021. This project evaluates the effectiveness of an ADA screening protocol in patients on antipsychotic medication. This DMP scholarly project will promote self-screening among patients on antipsychotic medication. So, the purpose of the project. The purpose of the project was to implement an ADA risk tool for adult patients on antipsychotic medications. The project has two aims. The first one is to increase the identification of patients at risk for T2DM, while the second aim is to increase the referral of those patients to their primary care provider for further evaluation and management. So, review of literature. 16 articles were reviewed and they were grouped into 4 themes. The first one is the pharmacological effect of antipsychotic drug on glucose metabolism. The second one is the antipsychotic drug association with higher diabetes risk. Drug use factor, that is type, dose, duration, and number, linked to increased diabetic risk. Then the fourth one is genetic susceptibility of mentally ill patients to T2DM. So antipsychotic drug association with higher T2DM risk. The research found a correlation between antipsychotic drug use and higher T2DM risk. It has been noted that antipsychotic increases the risk of T2DM and other metabolic abnormalities linked to obesity and weight gain. Type 2 DM is approximately 10 to 13% more prevalent among individuals taking antipsychotic drug across age groups, race, and gender. The incidence is 2 or 3 times higher than in the general population, according to Chang et al. 2015. So drug dosage was linked to higher T2DM and indicated that antidepressant induced diabetes. Patients prescribed antidepressants were more likely to develop T2DM within 2 years. The duration of drug intake was also found to increase the risk of T2DM. It was posited that antidepressant use over long period increases patients' likelihood of developing type 2 DM. So the theoretical framework. The theoretical framework used to guide the DMP project is Kurt-Lewin's change model. It helps to initiate healthcare service delivery change to offer proactive T2DM care using the ADA risk tool. So on this slide, we want to discuss about ADA screening tool. It is a simple screening tool available for free online. It has set of 7 questions with varying scores. Scores of 5 and above indicate risk of T2DM. It can be self-administered with minimal guide. So what are the interventions? ADA screening protocol intervention was done. Staff educated the patients on the importance and need for ADA screening, to which they consented. Patients on antipsychotic medications that met the inclusion criteria were screened. Patients at risk for T2DM that were identified were referred to their primary care provider for management. Method and design. The scholarly project adopted a quantitative methodology. A retrospective chart review was done. The project was carried out in a selected mental health clinic. The project targeted psychiatric patients between the age of 18 to 65 years that are on antipsychotic medication. 120 subjects were entered, 60 records pre and 60 post. were utilized to compare the intervention of the screening protocol. So now the sample. The participants' age distribution were in 3 groups. The first set was between age 18 and 30. The second one was between age 31 and 50, and the last one 51, between 51 and 65. So when you look at the slide, the largest group was 31 to 50 years. 36 subjects were male and 24 subjects were female. So the sample consisted of 40%, which number 24 female, and 60% number 36 male patients. So this slide shows the participant ethnicities. 48% were African American, 32% Hispanics, 20% were Caucasians. So in this slide, it shows that the ethnic groups were well represented. So data analysis. Upper test, Z-test were utilized to determine the significance of the study. C-test was chosen due to the sample size. So the results. Pre-intervention, the number of items of interest was 0. Sample size was 60. Then the post-intervention, number of items of interest were 9, and the sample size were 60, just like the pre-intervention size. So the Z-score analysis was done. 0 out of 60 patients were at target range pre-implementation. So 51 out of 60 patients were at the target range post-implementation. The value of Z is 6.9406. The value of the P score is less than 0.0001, while the result is significant at P less than 0.05. The strength. Ethnic diversity was employed, making the result more generalizable. And findings are comparable to the result of the earlier studies performed, which implies utilization of the correct methodology for the conduct of the project. So limitation. The project has 3 limitations identified. The first one is the project focused on post-implementation only, as pre-implementation yielded no T2DM screening. The second one is that the project was conducted over a period of only 3 months. This indicates that the follow-up was done over a short period of time. And the third one is that the patients were not directly involved, and the project relied heavily on the patient's EHR. So the discussion. ADA screening tool was effective in identifying patients at risk for T2DM. So, at-risk patient identification and referral went up from 0 pre-intervention to 9 post-intervention, which is a significant finding based on the statistical p-value. Screening of patients on antipsychotic medications for T2DM results in early detection and subsequent referral for management. So, what are the implications for practice? ADA screening tool will help psychiatric patients on antipsychotic with early detection of type 2 DM. Providers should screen all patients on antipsychotic for T2DM. Then the third implication is that the overall healthcare cost will be reduced as a result of early management and prevention of complication in patients. So here are the few recommendations. Healthcare facilities should integrate ADA screening as part of the management initiative for patients taking antipsychotic medications. Staff at mental health facilities should be educated on the use of ADA screening tool to enable them to educate patients on the importance of the topic. Future projects should be more comprehensive and consider having physical interaction with human subjects rather than using the EHR. The conclusion. The research showed that the implementation of the ADA screening tool protocol is beneficial in helping individuals on antipsychotic medication to know their status and referral to their PCP for management. The project assisted in broadening the knowledge of staff about non-pharmacological approach required for helping persons at risk for T2DM in the target population. Healthcare facilities should integrate ADA screening as part of their management initiative for patients taking antipsychotic medications. Staffs should be educated on the use of ADA screening tool to enable them to educate patients on the importance of the topics. This is the end of my presentation. On the slide 21 is the question area. Should you have any question, please feel free to reach me at eitabiyi1@life.maryville.edu. eitabiyi1@life.maryville.edu. On the next slide are my references. Please take time to look at the references if you need to. Thank you for watching. Hope you gain something from this. Thank you.